Hello, family, and welcome back to another episode of Coffee with Dr. K. I got mine. Do you have yours? Let's sit back and let's chat a little bit. Today, we're going to be talking about physical therapy for your infant or toddler and what that looks like, what to expect. So, first off, physical therapy for an infant or toddler looks way different than it would look for an adult. In fact, my preference, I would much rather go to some pediatric therapy session for myself than to go to an adult one. It's just my preference. I am a team sport kind of person. I really don't care for 5 reps or sets of anything, much like I don't care for like running on a treadmill. Like, put me on a mountain and let me hike. Anyway, I digress. Totally digress there. All right, so your child's physical therapy session will likely look like a play session. But before the therapist starts playing, or maybe I don't know what your therapist's order will be. Many times during the therapy session, there'll be a question and answer segment where they will take a history. They will ask you, the parent or primary caregiver, what the needs are that you are bringing the child to therapy for. They will take lots of measurements. So you may see some really odd looking measurement tools depending on what your child is coming in for. Measuring head circumference. Sometimes we're measuring joint angles, tape measures, reflex hammers, and other tools. But you may see some things. Nothing we do for the most part is invasive, especially with children. So your babies don't have to be afraid of needles during this session. Your therapist will use a lot of toys to facilitate movement for your child because I don't know about you, but I don't know not one infant or toddler that if you tell them to give you 5 squats or 5 push-ups, that's going to do it. First of all, they don't even know what that means. So your therapist, if they want your child to look to the right and to the left, for example, might take a lighted or musical toy and have them follow it, follow the lights, follow the sounds. If they want them to squat, they might put something while the child is standing up. They put something on the floor and say, can you get that for your mommy? Or can you get that for me? And the child squats down and they stand back up. Your therapist in this process is analyzing your child's movements. They're analyzing their brain motor planning. What did the child look like? How long did it take for them to process the action, which was stoop down and then stand back up? Was there any asymmetries? Were they off balance any kind of way? They're analyzing those movements, and that's more data collection. So in my practice, the therapy sessions are completely always a family affair. I want the parents involved because at the end of the day, I'm going to go to my house and they're going to go to their house. However, we need the child to practice between sessions. So it is my job to teach the parents as much as I can teach them that is safe for them to perform on the child so that they can practice and reiterate certain skills and activities between sessions. So let me tell you, unfortunately, physical therapy is not a magic pill. Most times, you're not gonna just have one session and then all done. No, no, no. Physical therapy typically takes a few weeks, a few sessions. Some people, it could take a few months, depending on the diagnoses. It could be years and ongoing. It's not a magic pill. Your body's systems need repetition to really fine tune what they're supposed to be doing or to regenerate. If something's been lost, if a movement or a sensation's been lost, it takes those nerve cells a long time to actually like regrow, resprout, reconnect, and form the movements that need to be done. So I say all that to say, have some patience. This is an investment in your child's life. Look at it that way. Don't look at how much time it takes, how much money it costs. This is what my personal trainer tells me. Find a way to make it, right? We're all going to come together as a team, mom, dad, caregivers, child. We're going to develop a plan and we're going to find a way to get through this. And we can all do it together. A lot of times I'll use siblings. Siblings are great motivators. If your child, for example, is struggling with something like tummy time, you place that baby on their tummy and you loose a pet, a cat, a dog, something that runs past them, or you loose a sibling just to go play. It's so entertaining for them. And I've received so many pictures and videos from parents at babies who hate tummy time, But as soon as they're engaged in watching their pet or their sibling, it's not as much of a problem. So definitely, therapy is a family affair in my office. I think we've talked about what you're going to expect. There's going to be a lot of data collection. There's going to be a lot of analysis on the therapist part for the child. Oh, there's also going to be lots of education. So your therapist is going to educate you, the caregiver, on things that you can do. We talked about that. But they're also going to address a lot of your questions, your concerns, and you guys will come together and make goals. Okay, so you'll express to your therapist exactly what it is that you want to see in your child, what's not right in your opinion, what's not right, what are they not able to do, and what you'd like to see them do. And then your therapist is going to outline some goals based on what they're seeing and what you've communicated to them, and you guys are going to develop some achievable action points for this child. This is a journey, and I want you to enjoy each and every step. Your baby has so many systems in their bodies. They have a cardiac system, they have a vestibular system, they have a nervous system and a muscular system. All of those systems need to work together and work optimally to get your child functioning the best way that they can, to get them moving the best way that they can. And your therapist is there to teach you and to guide you throughout that process. So trust your therapist. Find someone who you really vibe with, who you can trust, who you love and they love you and your child, and buckle in, really strap in together with this therapist for this journey. I have for you, beautiful families. I hope you enjoyed this video. Please feel free to share, like, and subscribe. I look forward to seeing you again on another episode of Coffee with Dr. K. Take care.